Chapter 9. Controlling your weight. Are you one of those who must always worry about your weight? Is it hard to maintain a normal figure? Then this chapter is for you. 2,500 years ago, Hippocrates, the father of medicine, and a very keen observer, noted that fat men die suddenly. This is still true. Not in every case, of course, but sudden death occurs so often in fat people that doctors must raise a note of warning. Especially is this true in people who are sluggish and steadily gaining weight. In other words, the longer your waistline, the shorter your line. Yes, it is very important to watch your weight, not allowing yourself to become too thin or too fat, but trying to remain near the ideal. Most youngsters in their teens, if they are healthy and active, are fairly close to the ideal weight for their size and age. Why do so many of them change as they grow older? Usually because they no longer are as active as they were. Changes often come on in the late 20s, reducing a person's physical fitness. Sluggish habits begin to develop as the individual loses his skill in running, swimming, or other healthy activities. Yet in spite of warnings from nature, they continue to eat heartily, adding many unnecessary pounds, and finally losing their athletic figure. What a pity to change that youthful silhouette for a flabby, paunchy, unattractive appearance. Dangers of overweight. But, you say, aren't most plump people rather jolly and good-natured? Yes, that is quite true. They are usually pleasant and easy to get along with, but they are still overweight. Most of them give all manner of excuses for their fatness. But in almost every case the only reason is that they are eating more than they themselves really need. In other words, extra weight is due to extra eating. Ideal weight and overweight 69. It is surprising what just a few extra calories a day more than are actually needed will do to a fine, youthful-looking appearance. For instance, if you take just one extra slice of bread a day above your actual needs and continue this for 5 years, you will add 45 pounds to your figure. In 10 years you will have gained 90 pounds. But the trouble doesn't stop there, not by any means. All this extra fat puts a strain on your heart, kidneys, and liver, and also on the large weight-bearing joints, such as the hips, knees, and ankles. This means your body is wearing out more rapidly, carrying around all this extra weight. Those excess calories in your diet can be deadly. You are shortening your life at your own dining table. Your ideal weight. What is your ideal weight? That depends on your height, sex, age, and type of body build. There are different standards for men and women, and for people with large, medium, or small frames. You can easily find out how much you should weigh by looking at the weight tables in the appendix at the back of this book. People with large bones and well-developed muscles may seem somewhat overweight compared with those of lighter build. But actually the lighter person may be carrying around more fat. His muscles may be weak and underdeveloped. One must therefore judge carefully and compare his own weight with the standard for his age and body build. Even then one can allow for a few pounds one way or the other and still be fairly close to normal. Why some folks are fat? Now let us suppose you know you are about 30 pounds overweight. What should you do? First of all, try to find out why you weigh so much more than you should. Don't be shocked to learn that some people are overweight because they are worried and frustrated. To suit themselves they nibble a little here and there between meals. Munching adds weight rapidly. But, someone says, I don't eat as much as my sister. Just look how thin she is. Perhaps so. People vary a lot in how many calories they actually burn up. Perhaps the thyroid has something to do with this, at least in some cases. 70. Controlling your weight. Regardless of all this, if a person is gaining weight, it means only one thing: he is taking in more calories than he is using. Nature hates to waste good food. So instead of tossing out those extra calories, she stores them neatly away in the form of fat for future use. How easy it is for most of us to put on a few pounds, but what a job to take them off again. Just how many calories do you need per day? That depends on a number of things, such as the kind of work you are doing, your age, your body build, and how active you are. A hard-working laborer may require 5,000 calories a day. To keep going he should need only 2,000 calories a day. His wife, who is busy around the house all day, may need 2,500 calories. But an office secretary may do well on 1,800 calories a day. It all depends on how active we are. At 25 years of age we usually burn up our calories without any difficulty. At 35 the situation begins to change. We are now less active. We sit down more often, and perhaps use labor-saving devices to spare us further exertion. This means we must gauge the amount of food according to the work we do, and not what someone else may be doing. Are there other conditions that affect a person's weight? Yes, definitely. One may gain weight because of water accumulating in the tissues under the skin. For instance, a failing heart may produce the marked swellings in the legs and other parts of the body. So will certain kidney diseases. Such people must avoid the excessive use of salt. But this is not the usual reason why most people are overweight. Overeating is more likely to be the real problem. How can we change the picture? Two ways. Either we must increase the output of work, or we must reduce the food intake. How to lose weight sensibly? Dieting is not new to most people who are overweight. They have all tried this many times before. Some are so incensed at what their friends are saying about them that they will go without food entirely for a short time, only to return again to their former habits of overeating. Going to extremes rarely does any permanent good. The only solution is a completely new pattern of living, such as these simple steps outlined here. 1. Take smaller quantities of food. Continue with a balanced diet. Quality, not quantity is the rule. Be sure to include reasonable. How to lose weight 71. Amounts of potatoes and whole grain cereals in your diet. Eating slowly will help. Avoid all foods that are oily or high in fat. 2. Be careful about leftovers. Many housewives put on weight because they hate to see food wasted. Far better to prepare less food and avoid the problem of leftovers. 3. Stop nibbling between meals. Train yourself to get along on less food. Soon you will enjoy living on a reduced diet, and you will be surprised at how well you feel. 4. Sensible exercise, taken every day, will help to use up those extra calories. The best exercise is walking. Putting those large leg muscles to work will burn up unwanted calories. 5. Avoid rich desserts. All that excess sugar and fat is high in calories but low in food value. Your best exercise is to push yourself away from the table while you are still hungry. Stay clear of ice cream, pastry, rich cakes, and sweets. 6. Remember, regular eating is important. Your meals should be smaller than average, well prepared and attractively arranged on the table. There is no reason for you not to enjoy your meals, even though you are now taking less food than you once thought you needed. 7. Do not go hungry for long. Eating regularly but sparingly is the best way to lose weight. 8. Be sure to have a good breakfast. This will carry through the day, and you will be less tempted to nibble sweets and snacks between meals. 9. Use these foods freely: green leafy vegetables, tomatoes, and carrots. They are all low in calories, but high in vitamins and minerals and have real food value. Such things can also be used to ward off hunger pains between meals, if you must have something. Value of losing weight. All this may sound like a strenuous program, but it has many real advantages. Overweight people tend to suffer from serious conditions, such as high blood pressure, shortness of breath, sleeplessness, heart trouble, kidney disease, diabetes, and disorders of the liver. Bringing the weight down to normal will help the heart and every other organ in the body. It takes real willpower to lose weight, but it is certainly worthwhile. F6. 72. Controlling your weight. One final word: once you have reached your ideal weight, make sure you stay there. You must maintain this new way of life not only for the next year, but for the rest of your days. Tough? Perhaps. But once you have accepted this wonderful new way of living, you will find yourself enjoying your meals more. Your appetite will be keen with new appreciation of food flavors you never knew before. All this adds up to better health and greater satisfaction in living. Certainly it pays to control your weight. Watch for those high calories. Cashew nut, per 100 gm of edible portion, 596 calories. Coconut, dry 661. Cake, chocolate, 2-layer with icing 400. Butter, per 100 gm of edible portion, 729. Ghee, fresh 818. Vegetable cooking oil 900. Ice cream, vanilla 1/4 pint 150. Low-calorie foods. Milk, cows, per 100 gm of edible portion, 67 calories. Curds 46. Buttermilk 15. Orange 53. Banana 100. Leafy vegetables 1390. Suggestions for gaining weight. If you are slender and only a little under normal weight, you have certain advantages in health. It would probably be wise for you to stay that way, for thin people often live longer, provided they are not suffering from some wasting disease such as tuberculosis. But if you are very much underweight, you ought to at least have a complete medical examination to be sure there is nothing seriously wrong inside. There are two main types of thin people. One type is wiry and energetic, like a greyhound. Such people are seldom sick. They eat heartily, but never put on any weight. Because of their constant activity, they probably burn up their energy. Most of them would. Thin people 73. Like to put on a little weight just for the sake of appearance. Maybe they could, if they would stay still long enough. The other group of thin people are not wiry and energetic. They lack energy and drive. Most of them tire easily and often wonder what is wrong with them. They always envy those who can eat heartily, but usually find their own digestive organs unable to handle even normal meals. Rich foods usually make them feel sick. Rarely able to finish their meals, they just take a few bites and then feel full. What is wrong with this group? Some of them probably have small stomachs with low capacity. Such people could help themselves by taking smaller meals and eating more frequently. A few may improve their diet by taking drinks and fruit juices between meals. They should always choose plain foods, for rich meals usually disagree with them. All such people should have a complete X-ray of the digestive organs to rule out the possibility of some hidden disease. A stool examination would also be advisable to rule out the possibility of worms, some amoebic infection, and other harmful parasites. A complete blood count is recommended to be sure there is no anemia. The urine should also be carefully checked to eliminate any infection in the kidneys or bladder. Nervous anxiety is another cause of anorexia, or lack of appetite. The child who feels rejected may suffer from a chronic type of anxiety in which he never seems to have a normal appetite. Eventually he may begin to show the effects of malnutrition. Just placing him in a more favorable environment will usually improve his appetite almost immediately. Remember, nagging and criticism will not help but may only deepen the child's emotional problem. A few multiple vitamin tablets may help to increase the appetite and return the body's functions to normal. Treatment: avoid taking snacks just before meals, for this often spoils the appetite. Eating a well-balanced meal, keeping on a high-calorie diet as much as possible. Avoid the use of tobacco, particularly just before meals. Above all, learn to relax. This will help reduce nervous tension while bringing the body's activities back to normal. Many thin people are completely exhausted because of nervous strain. Most of them are too conscientious, often worrying over situations they cannot hope to change. Some are just tied up in knots, so that their digestive organs cannot carry out their normal functions. 74. Controlling your weight. A quiet rest just before the evening meal and also before lunch may be all that is needed to bring back life and vitality to the whole body. Try cutting down on all those extra activities, for this too will help to reduce tension. Such a program, combined with restful sleep at night and sufficient exercise in the fresh air every day, is an excellent prescription for good health. Try it. Suggestions for growing taller. Every normal child longs to be grown up. He wants to do all the things he sees grown-up people doing around him. If he is not as tall as others, it is easy for him to feel slighted and perhaps somewhat rejected by those of his own group. Can anything be done to help a shorter person put on an inch or two? Yes, in some cases this is true. Normal growth is an amazing process. From the moment of conception until the day we are born, growth is extremely rapid. After birth we continue to grow rapidly for the first 2 years, then the process begins to slow down. Once again, around our 13th or 14th year we begin growing rapidly. This is the time known as adolescence. Girls grow more rapidly than boys because their hormones are more active in early puberty. Later the boys catch up and overtake them, usually reaching their full height between the 16th and 19th years. However, there are wide variations, depending upon certain important chemicals within the body. A person's height depends to a large extent on the length of the long bones in his lower extremities, particularly the femur in the thigh and the tibia in the leg. For good stature, the spinal bones or vertebrae must also be well developed in proportion to these long bones. Near the ends of the bones there is a transverse area known as the epiphyseal line, consisting mainly of cartilage in which the young bone cells are growing. During childhood and youth these young bone cells are continually adding to the length of the bones. This is how we gain in height and weight. However, growth is not steady throughout childhood. It seems to come in a series of starting and stopping, depending on changes in the endocrine organs. Thus one child of 9 may appear short for his age, only to catch up and pass the other by the time he is. Hormones and growth 75. 12. A similar variation in growth continues throughout adolescence, and in most cases seems to be governed by hereditary tendencies and other factors still not clearly understood. But once the epiphyseal lines have closed, there is no further growth in height. The bones may grow heavier, wider, thicker, but from then on it is doubtful if the individual can do anything more about his height. Hormone changes, particularly those involving the thyroid gland, may often alter a person's height. In hypothyroidism there is delay in growth and development, along with some mental slowness, fatigue, and also menstrual disorders. Thyroid tablets, when taken regularly, may help to correct the deficiency and actually cause the individual to gain in height and weight, provided the epiphyseal lines in the long bones have not already closed. The usual dose is 1/2 grains or 90 milligrams of thyroid extract per day. In addition, it is important to take sufficient protein in the diet. Racial characteristics must also be borne in mind before reaching the conclusion that one is too tall or too short. Hereditary factors always play a large part in body development. If one's ancestors are short and stocky, he can scarcely expect to be tall and slim. Growth failure in children may be due to other factors. The child's diet may be lacking in essential nutrients, such as vitamins, minerals, or protein. In many cases the total intake of calories may be inadequate to support normal growth. Again, certain diseases involving such organs as the liver, kidneys, pancreas, heart, or lungs may all contribute to a failure of normal growth. Food may not be properly absorbed and utilized by the body. Congenital heart disease must also be considered when growth is subnormal in childhood and youth. Then there is the very delicate balance between the various secretions of the endocrine glands. As stated on page 538, the growth hormone from the anterior pituitary may be lacking in some people, probably because of disease. A deficiency of this hormone, STH, can result in pituitary dwarfism. As stated above, thyroid deficiency may result in cretinism and hypogonadism, both of which retard normal growth. Ultimate stature then depends on both the rate and duration of growth. One might ask, why not give certain endocrine substances, such as male hormone? This may help in some cases, but it may also close the epiphyseal lines that much more quickly, thus shortening the duration of growth. 76. Controlling your weight. Any young person who is not growing as rapidly as expected should always be carefully studied to find the possible cause of growth failure. Parents should realize that any sudden slowing in growth rate may indicate the beginning of some serious disease. X-rays may reveal the presence of rickets or some serious vitamin deficiency. If the patient is suffering from malnutrition, the addition of vitamin B supplements may help stimulate the appetite and establish a new pattern of growth. Pituitary dwarfism results from a failure of the anterior lobe of the pituitary gland. This may be due to some congenital condition or perhaps a tumor invading the pituitary. Pituitary dwarfs, unlike cretins, usually have normal intelligence. The body is well proportioned, but all the features are diminutive, and many of the physical manifestations of childhood are retained throughout life. Treatment. Once the correct diagnosis has been made, most doctors prescribe thyroid, 1 to 2 grains per day. Boys are also given methyl testosterone, sublingual tablets 5 mg twice daily. Both of these substances increase the size and weight of the skeleton. Girls with this condition are given estrogenic substances, such as diethylstilbestrol, 0.5 million Guaranese tablet each day for 3 weeks, followed by a rest period of 8 days. This cycle is then repeated as long as needed for growth. A diet rich in proteins and minerals is of value, even though full stature is not usually attained. If a tumor is present in the pituitary, X-ray therapy or surgical removal